name's Aubrey. I'll be your student nurse today. Can you go and give me your name and date of birth?
Abby Meyer, 12/05/2004.
Nice to meet you, Abby. Do you know where you are today?
Saginaw Valley,
Perfect. And then do you know the current year?
2025.
Good. So you're oriented times 3, so I feel comfortable continuing with this examination. So what we're going to do today is we're going to do a head-to-toe assessment, starting at your head, working your way down to your feet, just checking everything out, making sure it's functioning well. Before we start, though, I do have a couple of questions to ask you, if that's okay.
Okay.
Just go ahead and answer these to the best of your abilities. First things first, do you have any allergies?
No.
No. Do you take any medications, herbals, or supplements?
No.
No. Any current or past diagnoses?
No.
No. Any surgeries?
Just my wisdom teeth.
Your wisdom teeth. Any complications with that?
No.
No. Any family history you need to know about?
My dad does have AFib.
He has AFib. Okay. Have you had any problems with that?
No.
Okay, good. Next thing, like I said, just answer to the best of your abilities. What does your diet normally look like?
I usually eat 2 meals a day. I usually skip out on breakfast, but I make sure I incorporate my fruits and veggies.
Okay, good. Are you getting enough fluids?
Yes.
Okay, good. What does your exercise normally look like?
I try to walk every day,
Okay, good. For about how long would you say?
like 20 to 30 minutes.
Okay, good. Just make sure you keep up with that. It's good to get some activity in, even when it's getting colder outside already.
Okay.
And then, like I said, a little bit more uncomfortable. Do you have any problems with incontinence?
No.
No. Any smoking?
No.
Drinking?
No.
Okay, perfect. And then, do you have any pain today, Abby?
No, I don't.
No. Okay, great. So that's all the questions I have for you. I'm going to go ahead and move on to vitals, if that's okay with you.
Okay.
Okay, so I don't have a pulse ox with me, but if I did, I'm going to assess for clubbing first. Just going to go ahead and look. Check those thumbs out. Good. Okay, I don't see any clubbing present. That would indicate decreased oxygenation to your fingers. And I don't see you struggling to breathe, no tripod position, accessory muscle use, flaring of your nostrils, or pursed lip breathing. So I'm not concerned about your oxygen. I would expect you to be about 96 to 100 if I had a pulse ox on me. Next thing I'm gonna do is I'm just gonna go ahead and feel your temperature already.
Okay.
Do you feel feverish at all?
No.
Okay, good. You don't feel feverish. You don't look like you're having the chill, so I'm not concerned there. If I had a thermometer, I'd expect you to be about 98.6 degrees Fahrenheit. What I'm gonna do next is I'm gonna go ahead and take your blood pressure. Do you care which arm?
No.
No, okay. I'm gonna do your left one. And then what does your blood pressure normally run, Abby?
Like the 110s, 120s.
Gotcha. Alrighty. And then let me know if you have any pain throughout this assessment at all, alrighty?
Okay.
And then this will just be a little bit of pressure. Shouldn't be too painful at all. I'm just gonna find your brachial pulse here. Good. Alrighty, can you unflip your arm up for me, Abby? Good. Right, your knees are uncrossed. We're good here. I'm gonna listen with my diaphragm. I'm just going to fix this cuff a little bit here so I can see this. That's better. Perfect, that's better. Alrighty. Like I said, just a little bit of pressure here.
Okay.
Alrighty, Abby, your blood pressure is 112/70, so that's within normal range, and it's within normal range for you, so I'm not at all concerned there. Take this cuff off here. Good. Alrighty, Abby, what I'm going to do next is I'm going to go ahead and take your pulse. This will take me about 1 minute to 2 minutes, so just go ahead and relax. I'm going to take it on this hand if that's okay with you.
Yeah.
This is going to be your radial pulse. Good, Abby. So your pulse was 76, your respirations were 12. Both within normal range. You're, like I said, when I did your oxygen, you're not looking like you're using any of those accessory muscles, like you're having any trouble breathing. I'm not at all concerned about your respiratory rate or your pulse. Do you have any questions for me before we go on?
No.
Perfect. And then you didn't have any pain throughout those, did you?
No.
Perfect. What we're going to do first is we're just going to look at your arms.
Okay.
I'm just going to roll up both of these sleeves. Okay, I'm just going to look. A couple of moles. Any problems with those?
No.
No, I don't see any bruises. Same thing here, a couple of moles. I'm just going to go ahead and lift this arm up, okay? And then will you turn it over for me? Good, no moles there. I'm going to flip this one over. Good, okay, good temperature, good color, all the way down. I'm just going to look at your hands here. Nice and warm. Go ahead and flip them over for me. Good, no problems there. Go ahead and relax. I'm just going to check for muscle symmetry here.
Okay.
Good, nice and symmetrical. Okay, we're going to work, and we're going to do some capillary refill on your fingers. So what this is going to be is it's just going to test perfusion. So I'm just going to squeeze on your fingernails, and I'm looking for the color to go away within less than 3 seconds.
Okay.
So I'm just going to take these two. Good, that color went away with less than 3 seconds, so I'm not at all concerned about your perfusion of your tissue, so that's good. Nice and symmetrical muscle tone. Like I said, good color, good temperature, a couple moles, but is that pretty normal for you?
Yeah.
Okay, good. So everything with your arms looks good. I'm not at all concerned there. Do you have any trouble moving any of your arms or anything like that? No. Okay, perfect. So what we're gonna do is we're gonna do a range of motion test, if that's okay with you.
Okay.
Okay, so I'm just gonna roll these down. And then before we do range of motion, I'm gonna check your radial pulses here. Good, nice and strong and symmetrical there. I'm gonna do your brachial pulses as well here.
Okay.
Good, nice and strong and symmetrical there too, so I'm not concerned with those. Let me fix this cuff here. I got a little rolled. Okay, that looks good. Alrighty, now we're gonna move on to your range of motion. So, do you know how to swim?
Yes.
Perfect, so we're gonna start with one arm. You're just gonna do a swim forward and then you'll swim backwards.
Okay.
So I'm just gonna feel your shoulder. Go ahead and swim forwards for me. A little bit of crepitus, go and swim backwards. Good, okay, then relax. Is that normal for you to have a little bit of creaking in your shoulders?
Yes.
Okay, we're gonna do the same thing with the left one here. Go ahead and swim forwards. Good, backwards. Good, okay, not as much in that one. Next we're gonna do your elbows. So like you're lifting weights here. I'm just gonna feel your elbows for crepitus here. Good. Okay. Good. Go ahead and relax. Good. So no crepitus felt in the elbows. Same thing with your wrists. You're just gonna circle them in and then we'll circle them out. And I'm just gonna feel them already.
Okay.
Go ahead and circle in. And circle out. Good. A little bit of crepitus there. Is that normal for you?
Yeah.
Okay, good. Nothing too abnormal if that's your normal, so I'm not concerned with any of your range of motion in your upper half. We're gonna go ahead and do a strength test with you. So what you're gonna do is you're just gonna go ahead and squeeze my fingers. Good. Okay, and then I want you to go ahead and put your hands in a karate chop. And I'm gonna push your hands in, don't let me push them in. Good. I'm gonna push your hands out, don't let me push them out, okay? Good. Alright, and then put your hands up. I'm going to push down, don't let me push down. Good. And then flip your hands the other way. I'm gonna push up, don't let me push up, okay? Good. Alrighty. So your strength is nice and symmetrical. No hand went higher than the other, so I'm not concerned there about anything strength-wise. So while I'm at your hands, I want to do some cerebellar function with you, if that's okay?
Okay.
Perfect. So what you're gonna do first is you're gonna go ahead and make the okay sign. Good. And then you're just gonna touch each finger to your thumb. Good. And then go faster. Good. Okay. And then the next ones you're gonna be putting your palms flat on your legs. And then flip them over, and then flip them back, and then do it faster. Good. Okay, you can go ahead and relax. And then the last one is gonna be, you're gonna touch your nose, and then you're gonna go ahead and touch my pen light. Nose, pen light, nose, pen light, nose. Okay, good. Go ahead and relax. Okay, so your cerebellar function looks good. Everything, range of motion and strength-wise, looks good in your upper half. I'm not at all concerned there. Do you have any questions for me before we move on to your hair?
No.
No? Okay, perfect. Do you have any problems with any infestations at home? No? Okay. Can you go ahead and take your hair out for me, Abby?
Sure.
And then just let me know when you're ready. Good?
Yep.
Okay. I'm just gonna look in your hair, alrighty?
Okay.
Look for any moles. I don't see any moles. No dry scalp. No rashes. Do you dye your hair at all, Abby?
No.
Okay, good. I'm just gonna go look at the back of your neck here. Looks good. A couple moles on the back of the neck. Is that normal for you?
Yeah.
Okay, I'm gonna do the same thing on the other side here. Just gonna look through. Couple of moles in your hair. Is this normal?
Yeah.
Keeping an eye on them.
Yes.
Good. Once again, no dry scalp here. Everything looks good. Back of the neck looks good. Good color on your scalp. No rashes, no lesions that I could see. Next thing I'm gonna do is I'm going to feel your head. If you feel pain at all during this assessment, just let me know, alright?
Okay.
I'm just gonna put my hands through your hair here. Just feeling that it's nice and symmetrical. Do you have any pain, Abby?
No.
Okay, good. While I have your hair done, I'm gonna feel your occipital lymph node.
Okay.
Okay, good. So that's non-palpable, so that's what we want, so that's good. Everything with your hair seems good. I didn't feel any bumps or anything non-symmetrical. Your head was nice and symmetrical. If you want, you can go ahead and tie your hair back. I'll do some hand hygiene while you do that. Good?
Yep.
Alrighty, so first things first, I'm just gonna look at your face.
Okay.
Looks like you've got some good color. Do you have any problems with anything with your face?
Just a little bit of acne.
Okay. Doesn't look like it's bothering you too much right now. I see you have a little bit of a mole by your eye there.
Mm-hmm.
Your nose looks nice and aligned on your face. Your eyes are nice and symmetrical on your face. Eyebrows look good. Your lips look nice and symmetrical. And your ears also look good and aligned. So I'm just going to go ahead and feel for temperature. Like I said, you've got good color. A couple of moles, but that seems pretty normal for you.
Yeah.
You have good temperature, good color. So what we're gonna do now is we're just gonna go ahead and move on to your face and do cranial nerve number 5, which is your trigeminal nerve. So what this one's gonna be is I'm going to feel your jaw and you're just gonna clench it and then unclench it, okay?
Okay.
I'm just gonna put my hands here, unclench, unclench, clench, unclench. Good. Okay, so that was feeling for muscles of mastication, so that looked good. Now I'm gonna do the second part of your cranial nerve number 5. And that's going to be sensory. So I just want you to go ahead and tell me where I'm touching, okay?
Okay.
Just go ahead and close your eyes for me.
Forehead, nose, left cheek, right cheek, chin.
Good. Okay, so that looks good. I'm not worried about sensory perception on your face. Did you have any problems feeling any of those?
No.
Good. Okay, so cranial nerve 5 looks good. We're going to go ahead and move on to cranial nerve 7, which is going to be your facial nerve.
Okay.
This one might be a little bit silly, but I just want you to go ahead and make some funny faces. So go ahead and smile for me. Good. Go ahead and frown. Good. Puff your cheeks out and raise your eyebrows. Good. So cranial nerve number 7 looks good and functioning well, so I'm not concerned there. While I'm looking at your face, I'm just going to feel for your sinuses, okay?
Okay.
So this is going to be your frontal sinus here. Any pain there, Abby?
No.
Good. And then your maxillary sinus here. Any pain?
No.
No. Okay, good. So your sinuses look good. Cranial nerves 5 and 7 look good. I'm going to go ahead and move on to your eyes now. Do you have any problems with your eyes?
No.
Do you see the eye doctor regularly?
About once a year.
Once a year. Okay, and you haven't had any problems with that then?
No.
Okay, good. What I'm gonna do first, I just want you to go ahead and close your eyes for me. Just looking at your lids here. The color looks good. Your eyebrows, like I said, look nice and symmetrical and aligned on your face. You can go ahead and open your eyes for me, Abby. Good. Okay. I do see a little mole here on the corner of your eye. Any problems with that?
No.
No. Okay, good. First things I'm going to do is I'm going to pull your eyelid up and you're going to look down and then I'll pull your lower lids down and you'll look up for me, okay?
Okay.
Just nice and gently. Okay, go and look down. Good. Go ahead and look up. Good. Okay, so your sclera was white, your conjunctiva was pink, and your lacrimal glands looked good. No abnormal discharge there, nothing I'm concerned about with anything looking at your eyes. So what we're going to do next is we're going to do a little bit of like a constriction with your eyes. So I'm going to shine a bright light in one eye at a time, and we're just looking for constriction of your pupils.
Okay.
So all I'm going to do is I'm just have you look straight forward at me, and I'm just going to shine this light in your eyes. Good, so that one constricted. Good, and so did that one. Okay, that looks good. What we're gonna do next is we're going to shine a light at the tip of your nose, and this is just going to test for your corneal light reflex. So just once again, go ahead and look straight forward at me here. Good. Okay, so the light reflected in the same spot in each eye, so I'm not at all concerned about your corneal light reflex. The next thing we're gonna do is we're gonna test for accommodations. So what I'm gonna have you do is I'm going to have you look at my pen light, and then look at my hand, pen light, hand, pen light, hand, pen light. Good. Okay, so your eyes are pearl up, your pupils are equal, round, reactive to light, and accommodating. So I'm not concerned there. Did you have any problems with that?
No.
No. Okay, good. And then what we're gonna do next is we're gonna test your 6 cardinal fields of gaze, which is going to test cranialers 3, 4, and 6. So 3 is your ocular motor, 4 is going to be your trochlear, and 6 is going to be your abducens.
Okay.
So what I want you to do is I want you to keep your head straight forward, and you'll just follow your my pen light with your eyes already.
Okay.
Good. Okay. So cranialers 3, 4, and 6 look functioning well. Did you have any problems with that, Abby?
No.
No. Okay, good. So I'm not concerned there. Everything looks good. I didn't see any abnormal movements with your eyes. So what I'm going to do next is I'm going to move on to your nose. Like I said, your nose looks nice and aligned on your face. I'm not concerned there. I'm going to go ahead and look up your nose if that's okay.
Yep.
Okay, so can you just go ahead and piggy your nose for me? I'm just going to look up it. Good. Nice and pink mucous membranes, nice and moist. I don't see any polyps. I don't see a deviated septum. I do see your turbinates, which is good, so that's not concerning at all. I don't see any visible obstructions, but I want you to go ahead and close one of your nostrils, and then breathe in. Good, and then switch. Good. Any problems with that?
No.
No. Okay, good. And then once again, do you have any food allergies?
No.
No. Okay, so what I'm going to do is I'm going to put the scent underneath your nose, and I just want you to breathe in and tell me what it is. This is testing cranial nerve number 1, your olfactory nerve, okay?
Okay.
Okay, go ahead and close your nose, or close your eyes, and just take a deep breath in, okay?
Coffee.
Good. Alrighty, so cranial nerve 1 looks good. I'm not concerned there. Did you have any problems smelling that?
No.
Good. Alrighty, so I'm gonna go ahead and move on to your ears. If you could just go ahead and move your hair off your ears.
Second.
Yes, perfect. Now I don't pull any of it. I'm just looking at the sides of your ears, and then behind. Looks good. Same thing with this one. I see you have piercings on both of these ears here. Any problems with those?
No.
Okay, good. Everything looks good there. I'm just going to go ahead and look in your ears since I don't have an otoscope. I can't look inside, but I'm gonna look at your external canal here.
Okay.
I'm just gonna shine this light here. Okay, good. Your external canal looks good. Nothing I'm concerned about there. Have those piercings caused you any problems, Abby?
No.
Okay, same thing with this one. Looking at that external canal. Good. And then just making sure those piercings aren't irritated behind your ears. Those look good. I'm not concerned there. While we're working with the ears, I'm just going to feel the rest of your lymph nodes. So I'm going to start behind your ears, feeling your post-auricular lymph nodes. Good. Your pre-auricular lymph nodes. Your submental lymph node. Your submandibular lymph node. Your, just gonna deep. I'm gonna tie this a little bit here, Abby,
Okay.
so it's not so tight on you. There, that looks better. Good. Your deep cervical chain here. And then can you shrug your shoulders forward for me? Feeling for your supraclavicular. That looks good. And then I'm just gonna test your skin turgor line on your clavicle here.
Okay.
Good. If it tended, I'd be worried about dehydration, but it didn't, so I'm not concerned about any dehydration there. While I am at your shoulders, I want to test cranial nerve number 11, your spinal accessory nerve. So I'm just going to put my hands on your shoulders. All I want you to do is just shrug. Good. And then can you go ahead and look that way? And look the other way? Good. Okay, so your spinal accessory nerve number 11 looks good. I'm not concerned there. Both of your shoulders went up and down together. All of your lymph nodes were non-palpable, so that's good. Your skin turgor did not tent on your clavicle, so I'm not worried about dehydration. So everything looks good there with your ears and your lymph nodes. So I'm gonna go ahead and move on down to your mouth, okay?
Okay.
Okay. So your lips look nice and symmetrical. A little bit of a mole above your lip. Have you any problems with that?
No.
No, okay, good. Yep, nice and symmetrical. Can you go ahead and pull your lip down? Good. I'm just gonna shine this light looking at your gums here. Nice and pink and moist gums. I don't see any bleeding gums, no receding gums. Your lips look nice and pink and moist. You can do the same thing to the top one for me. Looking at those gums. That looks good. Your lips look good. Same thing with the gums. No bleeding gums or anything like that. About how often do you go see the dentist, Abby?
Every 6 months.
Every 6 months? Okay, good. And then you said you had those wisdom teeth out. Have you had any other problems with anything in your mouth?
No.
Okay, perfect. I'm gonna go ahead and look in your mouth.
Okay.
If you could just open nice and wide for me, okay? Good. Your soft palate looks, your hard palate looks good. Your tongue looks nice and pink and moist. Under your tongue looks good. I don't see any cavities. Can you go ahead and stick your tongue out for me, Abby? Good. Your uvula and soft palate looks good. Your tongue looks nice and pink. Nothing problem-wise. I didn't see any of your wisdom teeth in there. And then I did note your tonsils. So that's good. They weren't overly enlarged, but I did see them poking out there. Can you do me a favor and go and stick your tongue out? Making sure it's nice and symmetrical there, which it is, so that looks good. So you can go and put it back in. I'm going to test cranial nerves 9, 10, and 12. 9 is going to be your glossopharyngeal, 10 is going to be your vagus, and 12 is going to be your hypoglossal. So I'm going to go ahead and test 9 and 10 with a little bit of a gag reflex kind of. With a spoon, do you have a gag reflex?
No.
Okay, perfect. So what I'm going to have you do is I'm going to have you stick your tongue out, I'll put the spoon on, and then I'm just going to watch for your soft palate and your uvula to raise symmetrically when you say ah, okay? So just go and stick your tongue out and say ah for me.
Ah.
Good. Okay, so your uvula and your soft palate both raised. So that looks good, so I'm not concerned about anything there. Like I said, your tongue looks nice and symmetrical. Can you go ahead and stick your tongue out for me? And then can you move it side to side? Good. Okay, so that's testing cranial nerve number 12. Looks good. I'm not concerned there. I'm just going to go and look at your neck first because I'm going to finish my cranial nerves. Looks like you have good color, good temperature, a couple of moles there. I'm just noting alignment of your trachea here. That looks good. Okay, and then I'm going to test for cranial nerves 9 and 10, your swallowing reflex, okay? So I'm just going to put my hands here. If you could just swallow for me. Good. Okay, any problems with that?
No.
No. Okay, good. So your cranial nerves 9, 10, and 12 all look to be functioning well. Everything with your mouth looks normal. You're going to the dentist regularly, so I'm not concerned there. Before I move to the back of you, I'm just going to listen for your carotid arteries, okay?
Okay.
So what I'm going to do is I'm going to be listening for bruise, which is like a swooshing whooshing sound, which we don't want to hear in our arteries. Since you don't have any problems with coronary artery disease, I'm going to lightly feel first, and then I'll auscultate with my bell, and then I'll feel a little bit more deeply, okay?
Okay.
Okay, I'm just going to go ahead and lightly feel here. And then, like I said, your neck looks good, nice color, good temperature, nothing I'm concerned about there. Just going to go ahead. Listening with my bell. If you just go ahead and hold your breath for me. Good. Okay, I'm going to go on the other side now. Just lightly feeling here. Can you go ahead and hold that breath one more time, Abby? Good. Okay, so no bruises were present. I'm not at all concerned there. I'm going to go ahead and just lightly palpate them, one at a time here. Just feeling your right one first. My hand is over here. Good, nice and strong. And then I move on to your other one. My hand's over here. Nice and strong as well, Abby. So I didn't hear any bruises, and both of your pulses were strong. So I'm not at all concerned there with any of your carotid arteries. I am going to go ahead and feel for your thyroid. So for this, I'm going to go around to the back of you, and I'm going to displace your trachea, and I'm just going to be swallowed, but I will talk you through everything. If you at any point feel uncomfortable, just let me know, all right?
Okay.
Okay, I'm going to go around back. Alrighty, Abby. Okay. So what I'm going to do is I'm going to have you tip your head back for me. Okay, right there. Alrighty, Abby, are you okay?
Mm-hmm.
Okay, I'm just going to displace your trachea. Go and swallow for me. Good. Just going to meet my other hand. Okay, go and swallow. Good. Any problems with that?
No.
Good. Okay, so your thyroid didn't feel abnormal while you were swallowing, so I'm not concerned there. What I'm going to do next is I'm going to go ahead and look at your back, okay?
Okay.
Perfect. Okay, so your color looks good. Same thing, couple of moles on your back. Is that normal for you?
Yep.
You're just keeping an eye on them?
Yeah.
Okay, good. Color, good temperature. Have you ever been diagnosed with scoliosis?
No.
Any problems with your spine?
No.
Okay, can you go ahead and just lean forward for me so I can note your spine? Good. Okay, so there's your spine. So everything looks good there. I'm just gonna feel for your AP diameter here. So feeling 2 to 1. So that looks good there. So I'm not concerned there. Like I said, your spine is aligned. Abby, I'm just gonna pull these shorts down just a little bit if that's okay with you.
Yep.
Okay, good. And then what I'm gonna do next is I'm gonna feel for symmetrical lung expansion. So I'm just gonna have my hands on your lower back, and all I want you to do is just take a deep breath in when I say okay.
Okay.
Okay, just go ahead and breathe in. Good, I'm gonna move up just a little bit, make sure I'm in the right spot, and then go ahead and breathe in one more time. Good. Okay, so your lungs raised symmetrically, so I'm not at all worried about one lung not working correctly or like collapsed or anything like that. So your lungs are ending right here at T10. This is your bases right here. So everything looks good there. Like I said, nice and symmetrical. So what I'm going to do, Abby, is I'm going to listen in a half moon shape. If you can go ahead and bring your shoulders back and then go ahead and relax. I'm going to stay off your scapula and off your spine, listening in a half moon shape here. So every time I put my diaphragm down, if you can just go ahead and breathe in and breathe out, and then I will move my stethoscope, okay?
Okay.
And at points I might have to move your bra if that's okay with you.
That's fine.
Okay, perfect. If you need a break at any point, just raise your hand and we'll take a break, alrighty?
Okay.
Alrighty, I'm just gonna have you tip your head just a little bit. So spine, scapula. We're about halfway through, Abby. Do you need a break?
No, I'm good.
Okay, for this one, I'm gonna have to go under your bra if that's okay with you.
Okay.
Okay. And then I'm gonna go ahead and lift up your bra if that's okay with you.
Okay.
Good. Good. Alrighty, Abby. So your lungs sounded clear. I didn't hear any crackles or wheezes. So I'm not at all concerned about there being fluid in your lungs. I hit in 12 different spots, so that was good. I'm not concerned there. What we're gonna do next is we're gonna do a little bit of percussion. So I'm gonna be doing the same motion, but I'm gonna be tapping on your back, okay?
Okay.
Just let me know if you feel pain through any of this assessment. We're just gonna be listening for resonance. Doing okay?
Yep.
Alrighty, I'm gonna go in your bra again, okay, here?
Okay.
And then I'm gonna roll it up again. Alrighty, Abby. So that's good. I heard resonance in all 12 spots. So I'm not at all concerned there. What I'm going to do is I'm going to have you lay down in bed, but I'm going to come on the other side to help you get into bed, okay?
Okay.
We'll get you underneath these covers here. If you want to swing your legs in. Good. Okay, I'm going to cover you up here. Alright, perfect. I'm going to fix my sticky notes here. I'm going to take this pillow away for just a second. And then what I want you to do is I want you to go ahead and look that way. Perfect, that way. Good. Okay, then I'm going to come on the other side and we'll switch sides, okay? And you can go ahead and look the other way for me. Good. Okay, so I was just looking for jugular vein distension, which I did not see. If I was concerned, if I did see jugular vein distension, I would raise the head of your bed 45 degrees, and then I would reassess, and I would be worried about fluid volume overload. But I didn't see any, so I'm not concerned there. Right. Just want my hand sanitizer. And then for this part of the assessment, I am going to have to expose your upper half. Is that okay with you?
Yep.
Perfect. If you want, I can pull them, or you can pull your gown. We'll keep you covered there. Good. Okay. Good?
Yep.
All right, I'm just going to look at your chest here. A couple of moles. Is that pretty normal for you?
Yeah.
You got some good color, nice and tan on your chest here. Everything looks good there. Good symmetrical, like rising and falling of the chest, so I'm not concerned there. So Abby, what we're gonna do is we're gonna listen in 5 spots. I'm gonna start on the patient's right side, and I'm gonna listen to your aortic valve. We're gonna listen with my diaphragm for lub dub, which would be S1, S2, and then I'm gonna listen with my bowel for any murmurs, okay?
Okay.
So you just go ahead and relax. You don't have to breathe in or out regularly or anything like that, okay?
Okay.
I'm just gonna flip for your clavicle. There's a little hair here. Clavicle, space. Rib 1. Rib 1. Rib 1. Space. Rib 2. Space. Looks good. I'm just gonna recheck to make sure I'm in the right spot. Clavicle, space. Good. Rib 1. Rib 1, space. Good. Rib 2, space. Alrighty, this is going to be your aortic valve here. Good, lub dub, and then switching over. Good, no murmurs. I'm gonna go ahead and move on to the patient's right or left side here. Okay, clavicle, clavicle space. Rib 1, space, rib 2, space. Okay, so this is gonna be your pulmonic valve here. I'm gonna listen with my diaphragm first. Good. And then listening with my bell. Good, no murmurs. Okay, so this is 2, rib 3, space 3. And then this is not a valve, it's just the loudest point in the heart. So this is Erb's point here, and then that was your pulmonic valve before that. But this is Erb's point here.
Okay.
Good. And listening for any murmurs. Good. No murmurs. Alrighty, so this is space 3. And then this will be rib 4 here and space 4. And then Abby, for this one, I'm just gonna stick my stethoscope a little bit into your bra here.
Okay.
I'll keep you as covered as I can, okay? And then this is going to be your tricuspid valve. Good, lift up. Listening with my bell here. Good. And then this was space 4. So I'm just gonna go ahead and meet my hand.
Okay.
Rib 5. And then space 5. And I'm gonna go mid-clavicular. I'm gonna go right there. Making sure I'm mid-clavicular here. And then this is going to be your mitral valve. And then I will listen with my diaphragm and then my bell. And then I will listen to your apical pulse for a full minute here.
Okay.
So I'm just going to, I'll make sure you're covered here the whole time. Good, lub dub. And then switching over. Good. Good, and then I'm gonna switch back over, okay?
Okay.
I'm going to listen to your apical pulse here for a full minute, so just go ahead and relax. Good, Abby. So your apical pulse was 78, so a little bit higher than the other one, but to be expected. We've been moving around. I'm gonna cover you up here.
Okay.
Good. Okay. Is that on good enough?
Yep.
Okay, Abby. So what we're gonna do is we're gonna do move onto your abdomen. So I'm gonna hold up this sheet, and if you can just move your shorts down to about your hip bones, okay?
Okay.
Good enough space here. And then you just let me know when you're ready.
Okay, I think I'm good.
All good? Okay. I'm just gonna go ahead and roll this blanket down here. I'm gonna roll your gown up. There, is that okay?
Yep.
Okay, I'm just gonna make this nice and flat. Good, so I'm just looking at the stomach. Got a couple of moles, is that pretty normal for you?
Yep.
Good, everything looks good there. I'm gonna look at it from the toes of the bed here. I'm just gonna make this a little flatter. Good. Looks good, this one too. There, that's a lot better. Good. Okay, that looks good. Just gonna check one more time from this side. Good. I don't see any obvious peristalsis. Abby, when was the last bowel movement you had?
This morning.
Okay, good. Everything looks good. Your color looks good. Like I said, a couple moles. Any problems with those?
No.
No. Okay, and then good rising and falling, nice and symmetrical. First thing I'm gonna do is I'm just gonna go ahead and feel for your aortic arteries here. So what I'm gonna do is I'm gonna roll this gown up a little bit. And we're gonna be doing like we did with your carotid. We're listening for brewery, so I'll be listening with my bell. Okay, that looks good. So I'm going to go ahead and I'm going to find your xiphoid process here. Just nicely and lightly pulling up your bra here and meeting it in the middle. Listening with my bell for any bruits. Listening to your aortic artery here. Good, no bruits are present. I'm just going to keep my finger here and I move down to your left renal artery here. Good, I didn't hear anything there. I'm going to move on to your right renal artery there. Good, and then I'll move on to your right iliac artery here. Just gonna go just above the iliac crest here and staying below the umbilicus there. Good, same thing, I'm gonna move on to your left iliac on this side, staying above that iliac crest and below the umbilicus here. Good. Okay, so I didn't hear any bruits in any of your aortic artery, your renal arteries, or your iliac arteries. So I'm not at all concerned there. What we're going to do next is I'm going to go ahead and listen to your bowel sounds.
Okay.
So I'll be listening in 4 quadrants, and then that'll be listening for those gurgles, and we should hear at least 5 to 30 gurgles in each quadrant, all right?
Okay.
Alrighty. So I'm going to start in your right lower quadrant here, listening with my diaphragm. Good. Okay, I'm going to move up to your right upper quadrant here. Good, and then your left upper quadrant here. Making sure I'm above the umbilicus there. And then I'll move on to your left lower quadrant here. And then this one should be the loudest. Good. Alrighty, Abby, so I heard at least 5 vowel sounds in each of your 4 quadrants, so I'm not at all concerned there. I'm just gonna feel your temperature now that I felt that there's nothing wrong there, and you've got good temperature. Like I said, you've got good color, but everything feels good. No bruits in those arteries, and at least 5 vowel sounds in each quadrant. So what we're gonna do next is we're gonna percuss each quadrant, and we're just listening for tympany. So I'm gonna start in your right lower quadrant, same quadrant formation that we did earlier.
Okay.
So I'm gonna start in your right lower. Your right upper. Good tympany. Your left upper. Good. And your left lower. Do that one more time. Good. Okay, little ticklish.
Yeah.
Okay, perfect. And then we're gonna go ahead and percuss your liver border. So I'm gonna do it on your right side here. Let me know if you feel any pain throughout this already.
Okay.
Good. Okay, I'm just gonna go ahead and percuss the border of your liver there. So that was dullness when we hit it. Okay, good. So your liver was dull once we hit it. I heard tympani all the way up to the liver and then dullness once we hit it. So what we're gonna do next is we're gonna do some light palpations. Let me know if you feel any pain throughout this, okay?
Okay.
Just do light here. Any pain there, Abby?
No.
Any pain?
No.
Left upper. Pain?
Nope.
Good. Left lower. Any pain there?
No.
Okay, I'm gonna do some deeper palpations. You let me know if you feel any pain there.
Okay.
Your right lower. Your right upper. Your left upper. Any pain, Abby?
No.
And your left lower here. Any pain there?
No.
Okay, good. Okay, so everything looks good with your abdomen. I'm not at all concerned with anything there. So I'm just gonna go ahead and inspect like the top upper halves of your legs, because I'm gonna go ahead and do like a femoral pulse on you, or listen to your femoral arteries. So I'm just going to uncover the blanket from your toes. I'll cover you up this way,
Okay.
and then look at your thighs here. I'm gonna untuck your bed sheet though. Okay, good. I'm just gonna go ahead and look at your thighs here. Good, looking good, good color, good temperature. I'm just gonna note thigh symmetry, and then we'll do it a little bit more in depth when we work our way down. But they feel nice and symmetrical. Good. Okay, so everything looks good with where I'm gonna be working at for your femoral arteries here. For this one, it might be a little uncomfortable. I'm gonna be listening in your like crepes of your pelvis here. So is it okay if I go up the bottom of your shorts?
Yeah, that's fine.
Okay, if you can just go ahead and fix your shorts to where you would like them, kind of like tuck them under your bottom a little bit, just so they don't argue at all. Is that good?
Yeah.
Okay, and then for this assessment, I'm gonna have you frog your legs, if you can go ahead and do that for me. Good, and then I'm just gonna uncover you as much as I have to here. I will keep the rest of you covered. I'll keep your stomach nice and covered here. But I will be going and feeling on your left one first, and then I'll feel your right one, and then I'll note symmetry, and then I'm gonna listen to them both, okay?
Okay.
So you'll just feel my hand, okay? Just go ahead and relax for me. Okay, good. I found that one. My hand's right here. Right there. I'm gonna feel your right one here.
Okay.
Good. Okay, just feeling for symmetry now. Okay, good. Those are nice and strong and symmetrical. I'm just gonna show the camera where my right one is here. So I'm right here, right here. I'm gonna take both my hands out, and I'm going to put my stethoscope on, and I'm going to be listening for any bruise in either of those. Like I said, they were nice and strong and symmetrical, but I'm gonna go ahead and listen with my bell on your left femoral here. So I'm gonna find it first. Good. Okay, and then I'm gonna listen with my bell here. And then I am right here. Good, I don't hear any bruise there. I'm gonna move on to your right femoral artery here. I'm just gonna put my hand in first. Okay, good. I'm gonna put my stethoscope in here, keeping you covered. I'm right here. And then once again, I'm right here. Okay, good, Abby. I'm gonna cover you up here. can go ahead and relax those legs. Okay, good. So I didn't hear any bruise. Your pulses were nice and strong and symmetrical, so I'm not at all concerned there. If you want to fix your shorts, you can go ahead and fix those to where you'd like them.
Okay.
Good?
Yep.
Perfect. I'm just going to keep you covered up here because I am going to uncover your legs already.
Okay.
So I'm just going to uncover these. And I'm just going to check out your legs here and see if there's anything abnormal. Is it okay if I take your socks off?
Yep.
Alrighty. I'm going to go ahead and slip these off here. Good. Alrighty, just looking at your legs. I don't see any bruises. I do see a couple of red spots. Did you shave your legs recently?
Yeah.
A little bit of irritation there?
Yes.
Okay, perfect. Is that pretty normal for you?
Yeah.
Okay. Happens to the best of us. Okay, definitely chill your towards your toes. Is that normal?
Yeah, my toes are always cold.
They're always cold. Have you always dealt with that?
Yeah.
Okay, and no other problems other than that though with
No.
your legs? Okay, good. Good color, good temperature. I'm just gonna note for symmetry here. Good muscle strength and symmetrical. I'm not seeing any edema while I'm testing for symmetry there, so I'm not concerned there. I'm gonna check out your feet here, just looking at them. I'm just gonna look at the heels here. That looks good. I'm gonna go ahead and spread your toes apart here. I do see you have nail polish on.
Yep.
And then a couple moles on your toes there. I'm just gonna go ahead and look in these ones. And then I'm gonna lift your foot up again. Checking out that heel. Okay, it looks. Oh, you're good?
Yep.
No, you're good. Alrighty, so everything looks good there. Your looks nice and moisturized. I'm gonna test capillary refill on your toes. Same thing we did with your fingers, just on your toes. Since you do have nail polish on, I'm just gonna watch for your color to return on your actual toes here.
Okay.
Good. Okay, so your color returned at 3 seconds, so that's good. I'm not worried about perfusion to your toes. Like I said, they're a little bit chillier there, but you do have good perfusion to them. It just seems normal for you to be cold, especially with it being winter.
Yes.
So what we're gonna do next, I'm gonna leave your socks off here and then I'll put them back on. I'm just, like I said, everything looks good with your legs. I'm going to do a sharp and dull test on you if that's okay.
Yep.
Perfect. So this is gonna be dull.
Okay.
And then this is sharp. Can you tell the difference?
Yes.
Perfect. These are your thighs, your knees, your shins, and then your feet, okay? So if you can just close your eyes for me and then just let me know if it's sharp or dull and then where you're feeling it, okay?
Okay.
So just go ahead and close those eyes. Alrighty.
Sharp left thigh. Dull right thigh. Sharp left knee. Dull right knee. Sharp left shin. Dull right shin. Dull left foot. Dull right foot.
Good, you can go open your eyes at me. So you got 8 out of 8 on your sensory perception, so that looks good. I'm not concerned about anything there. I'm gonna go ahead and put your socks back on.
Okay.
But everything looks good. Your muscle strength is nice and symmetrical. You don't have any edema. Actually, I'm gonna take these off. Forgot one part. I'm gonna feel your pulses.
Okay.
Alrighty. I'm gonna go ahead and feel your popliteal pulse, okay?
Okay.
Are you ticklish behind the knees?
No.
Okay, good. Good. Okay, so those are both nice and strong and symmetrical there. And then I'm gonna do your posterior tibialis here. Good. So those both are strong and symmetrical there. I'm gonna go onto your dorsalis pedis here. If you can just go ahead and put your legs, there you go, perfect. Good. Okay, so those are both nice and strong and symmetrical there. So all your pulses are strong and symmetrical. I'm not at all concerned there. I'm not concerned about your perfusion, your strength, anything like that. So what we're gonna do next, Abby, is I'm going to sit you up and we're gonna do some range of motion like we did with your arms, but with your legs, okay?
Okay.
So I'm gonna get those covered up and then I'm gonna come up here and just stay sitting for 1 second. I'm gonna put some hand sanitizer on. And what we're gonna do is I'm gonna have you sit up on the side of the bed, alrighty? If you wanna fix your gown, fix your short as much as you need. You all set?
Yep.
Okay, good. Go ahead and sit up and then bring those legs out for me. Good, and then just sit on the edge of the bed. Good. I'm gonna tie your gown here. Good. Okay. And then I'm just gonna roll this up. I'm gonna test your patellar reflex here. Do you have any problems with your knees?
No.
No. Can you go ahead and close your eyes for me? Good. Okay, you can go up with your eyes. So your patellar reflexes look good. I'm gonna do some range of motion with your ankles.
Okay.
So I'm just gonna go ahead and feel your ankles. If you can just circle them for me. Good. Go the other way. Okay, you have some crepitus there. A little creaking, cracking. Is that normal for you?
Yeah.
Good. Okay. I'm gonna do some strength testing here. Oh, there's a hair there. I'm gonna have you. I'm gonna push in. Don't let me push in. Good. Okay, and then I'm gonna push out. Don't let me push out. Good. Okay, and then you're going to step on my hands like a gas pedal. Good. And then I'm going to put my hands on the top. You're gonna push up. Don't. Good. Okay. So everything strength-wise looks good. Your legs both, they went up and down at the same time, in and out at the same time. So I'm not concerned there. I'm gonna go and put your shoes on now.
Okay.
So what we're going to do next is we're going to do a Romberg test, which is going to test your vestibulocochlear nerve, which is cranial nerve number 8. So all that's going to do is I'm just going to have you stand up. We are just going to have you close your eyes for 10 seconds, and then we're just going to monitor you for any swaying.
Okay.
Just go ahead and set your foot in there.
Sorry.
No, you're good.
There.
Perfect. That's okay. And then I do not have a gait belt, but if I did, I'd put one on you. And then do the same thing. You got them tied pretty tight here. It's okay, I like to donut my shoes too. I do the same thing there. There we go. Good fit. Very good. Okay, go and stay there for 1 second. Alrighty, Abby, are you ready to stand up?
Yep.
Are you feeling dizzy at all from sitting there?
No.
Okay, why don't you just go ahead and stand up for me. And then I will hold the back of your gown open. Just go ahead and close your eyes and put your hands at your side. And just stand there. Good. Go ahead and open your eyes. So you have a negative Romberg, so I feel comfortable walking you. So all we're going to do, Abby, is I'm just going to have you walk to the doorway just nice and regularly here. Just going to walk that way. And then just go ahead and turn around. And you're just going to go heel to toe. Good. And then you can go ahead and sit on your bed. Good. Any problems or any dizziness?
No.
No. Alrighty, Abby. So I would give you a Braden scale of 23 because you're continent. I don't have any concerns about sensory perception. You have good activity, good mobility, good nutrition. I'm not concerned about any friction and shearing with you moving around in bed. Everything looks good there. So that's why I would give you a Braden scale of 23. Do you have any questions for me?
No.
Okay. Thank you for being my patient.
Thank you.